speed rolling.
Hi everyone, welcome to this week's edition of Toothy Tuesdays. This week we're going to be discussing oral cancers. I think that this is a very important topic because oral cancers are becoming quite the silent killer in our community because a lot of people really do not know about it. A lot of the patients usually present very late, and at this point the cancer may have spread to other organs. It's very important that we equip ourselves with all the knowledge about oral cancer so that we can help reduce the numbers of people who are losing their lives to it. Oral cancer is simply cancer originating from the oral cavity. So it could be cancer of the lips, the tongue, the hard palate, soft palate, cheek, all of these. Oral cancer occurs when the cells in the lining of whichever part that the cancer began start to behave in a very abnormal manner. As we all know, the human body is made up of cells. Now these cells have DNA which instructs the cells on how to behave. Now sometimes there's a mutation or a change in the DNA, and then this causes the cells to behave in a very bizarre manner. The cells become abnormal and they proliferate or they divide at an abnormal rate. As they continue to divide at an abnormal rate, this becomes like a lump, and then it spreads to other parts of the body, and this can be life-threatening when it invades other parts of the body. When it's detected early, a lot can be saved and the life of the patient also can be preserved. Let's look at some of the signs and symptoms of oral cancers. Persistent, non-healing ulcer. So you realize that you have this sore in your mouth that just won't go away after taking antibiotics and all kinds of mouthwash and all kinds of things. The sore just won't go away. That is a very, very classic sign of an oral cancer. You realize that you have a white patch in your mouth or a red patch in your mouth. These are all signs and symptoms of oral cancers. Now, difficulty swallowing, pain on swallowing, these are all signs and symptoms of oral cancer. The patients realize that they are losing weight at a very fast rate. At this point, the cancer may have gotten a bit too far. What do you do when you realize that you're having these signs and symptoms that we've discussed? Please see your dentist. Your dentist is very well trained and equipped to be able to detect these things and will refer you to an oncologist if the need may be. Usually the treatment options are surgery, radiation therapy and chemotherapy. This will be determined by your healthcare provider based on the stage of the cancer. Now there are certain risk factors that make you more susceptible to developing oral cancer. The first one is the use of tobacco, both smokeless tobacco and then the tobacco that is smoked. This is the number one risk factor for developing oral cancer. You know, some people don't smoke the tobacco. There's a smokeless one that they put in their mouth and that gives them the kick. That also puts you at a very high risk of developing oral cancer. Excessive alcohol consumption also puts you at a very high risk of developing oral cancer. Now, the use of excessive alcohol plus tobacco puts you at an even higher risk of developing oral cancer. People that have these two habits of excessive alcohol consumption as well as tobacco use have 6 times the risk of developing oral cancer. So it's a very important risk factor here. Secondly, chronic irritation in the oral cavity, sometimes from ill-fitting dentures or a jagged edge tooth. Tissues in the oral cavity are being irritated constantly by this irritant, and then this could be a factor that could put you at risk of developing oral cancer. Excessive exposure to UV light also could put you at risk of developing oral cancer. Thank you and see you next week.